how we created a 4-dimensional holographic diagnostic tool in ophthalmology, an augmented reality metaverse with patients' own real-time images. No financial disclosure. We have used Microsoft HoloLens 2 to create a world of 4D ophthalmic metaverse for patient diagnostics. Our mission was to enhance diagnostics in 4 dimensions using our own patients' real-time, high-resolution ophthalmic scan images for better outcomes. In diagnostics, we predominantly use 2D images which may have many limitations in data representation. Currently, 3D diagnostic systems are slowly becoming available, but 4D diagnostic systems have never been reported in the literature before. Why did we innovate a 4D diagnostic system? Obviously, to address a problem. For example, the fundus and OCT are limiting in image representation in 2D. Our solution software, IMG, brings the images to life in 4D where all dimensions of the eye from all the slices can be accessed. In this video, one can see how the fundus and OCT are superimposed one over the other for precise diagnostics, and moreover, they are available as holograms. The ophthalmic scan images are converted into holograms with a novel code developed by us, which is our intellectual property. Due to the lack of a comprehensive 4D diagnostic tool in ophthalmology, when the 3-dimensional eyeball is represented on a 2D plane, there are chances of data representative blind spots. Hence, we have innovated the software IMG to enhance the 2D scan images by projecting them onto a 4-dimensional environment. However, it is important to note that IMG is a translational software and not an imaging tool. Not only the posterior segment images can be translated, even the anterior segment images can also be translated into 4D, such as corneal topography, specular microscopy, ultrasound biomicroscopy, anterior segment OCT, and the Scheimpflug imaging system. In this video, on the right hand side, the doctor seems to be moving in an empty space, but in reality, he is wearing an augmented reality headset through which he can see and access all the patient's 4D case sheets by touch, as shown on the left side video. Now, the doctor uses the hand tracker system to enlarge the 4D eyeball case sheet to evaluate the anterior segment and rotates it with his hands to see the ora serrata. The angles of the anterior chamber can be visualized both in gonioscopic view and electron microscopic view. Now, the doctor is customizing the zoom and rotation to view the posterior segment structures of the eyeball. Let us see the IMG software workflow. For example, when a diabetic patient walks in and when we do the fundus photograph and the OCT for him, his 2D data enters the hospital database, which is intercepted by our 4-dimensional translational software IMG and is converted into 4-dimensional holograms in less than 60 seconds instantaneously with minimal chair time. Now, in the fundus holograms, you will have the OCT slices embedded into it. The doctor can choose different slices of the OCT images to make the diagnosis of diabetic macular edema as seen in this patient. Before treatment, the patients can be counseled with their own holograms for making them understand the disease process better. After treating the patient with pan-retinal photocoagulation and anti-VEGF injections, the patient's 4D case sheets can be generated and the resolving macular edema can be shown in various holographic slices at the holographic counseling stations established for the patients. Not only for posterior segment gadgets, this translational software is applicable for anterior segment gadgets as well. Let us see few examples. The healing cascade of striate keratopathy from postoperative day 1 to 1 month. In these patients, the holograms can be zoomed to focus on the cornea where all the different visits from first to last can be seen in the AIOCT template. 4D seam-plug imaging template can also be made use of to study the repair process of the various layers of the cornea and how the iris fumes suggestive of iritis also reduced from the postoperative day 1 to 1 month. In a Christmas tree cataract, 4D holographic phakic lens can be viewed to plan the intraoperative phakodynamic parameters. Doctors can also choose the ultrasound biomicroscopy template whenever needed for anterior segment pathologies. A good slit lamp photograph is mandatory for generating anterior segment holographic structures. Why we are unique is that there are no four-dimensional diagnostic innovations till date where real scan images are used. We are the first to invent it. Our model is a subscription model which is also available on other platforms apart from HoloLens 2 such as iOS, Android and the Windows. To summarize, our invention is a cutting-edge patent-protected 4D technology for diagnostics with precision translational software for tailoring therapy. The team that innovated it comprises of an experienced group of eye doctors and 4D generalists. There is no difference in the reimbursement codes and there are no constraints in the regulatory path. Our aim is to aid 4D ophthalmic diagnostics, assist in low vision rehabilitation, for example, retinitis pigmentosa as senior, create a medium for 4D telemedicine and assist in 4D artificial intelligence, aid in diagnosing retinal pathologies with 4D multimodal imaging examination along with additive use in the field of neuroanatomy pedagogy and microsurgical simulation module creation. Holograms are no more science fiction. It is a science-based reality. We have innovated and incorporated it into ophthalmology practice in real time. With time, our software will advance from 4D diagnostics to 4D clinical OPD and surgical procedures. Thank you.